All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Good evening. Welcome to yet another episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. I am Jasila Mujib. This is a talk show exclusively dedicated to your health related queries and concerns. Hypertension during pregnancy is a condition, if left untreated, may lead to many complications for the mother and the baby. To discuss about this subject, we have with us Dr. Jasmine Shankaranarayanan from Al Hilal Hospital, Salmabad. She is a specialist in obstetrics and gynecology with an experience of over 13 years. So let's discuss the topic with the doctor. So doctor, welcome to the show and thank you for joining us today.
Hi, thank you for having me.
How can you define hypertension during pregnancy and what are the symptoms associated with it?
Hypertension during pregnancy is otherwise called gestational hypertension, and it is defined as the detection of high blood pressure for the first time at around more than 20 weeks of pregnancy, or we can say 5 months of pregnancy. So we need to get at least 2 high recordings of blood pressure, that is more than 140/90 millimeter mercury, and it should be around 4 to 6 hours apart. We get 2 high readings. That's when we say it is a gestational hypertension. Coming to the symptoms of hypertension in pregnancy, it is the same symptoms as we see in another hypertensive patients, and the commoner symptoms we get is nausea, vomiting, headache. There may be blurring of vision, other visual disturbances. There may be gastrointestinal problems like upper abdominal pain or pain below the right rib cage, and they may have some kidney associated problems like difficulty in passing urine, less urine output, so far.
And what are the different types of hypertension found during pregnancy?
Overall, we have broadly divided it into 4 types of hypertension. The commonest and the mildest is the gestational hypertension, as we have elaborated earlier. So in gestational hypertension, all we see in the patient is a high recording of blood pressure, but there are no other signs of damage caused by the high blood pressure. The second variety we have is preeclampsia. So, in preeclampsia, what happens is we see in a patient, in a pregnant woman who is more than 5 months pregnant, she will have a high recording of blood pressure, and along with that we do a test called the urine dipstick test, in which we test the urine for the presence of protein. So, if proteins have been excreted in the urine, which is not a normal thing, it is abnormal. So, if you see protein in urine, that means that patient has gone into the next level, that is preeclampsia. Now, in preeclampsia itself we have two levels, either it could be mild preeclampsia or severe preeclampsia. In mild preeclampsia, the blood pressure will be like slightly elevated, like maybe 140/90 millimeter mercury or 150/100 millimeter mercury, and there will be protein in urine, but we grade the severity of the protein in urine as 1+, 2+, 3+. So, it will be of milder excretion like 1+. But in severe preeclampsia, we will have a very high blood pressure, maybe more than 160/110 millimeter mercury, and the protein in urine also will be higher. It may be going up to 3+ or 4+. Then coming to the next variety, we should also discuss, yes, with preeclampsia, when it is of a severe variety, there may be associated, the patient may develop convulsions. Okay, convulsions means fits, fit seizures they will develop. So, that is when the preeclampsia becomes eclampsia. Eclampsia means convulsion. The next variety, the third variety, is chronic hypertension. In chronic hypertension, the complications are much more, because chronic hypertension, from the word itself, it's chronic. So, it is either detected for the first time in pregnancy, but before 5th month of pregnancy, or it has been detected even before pregnancy in this patient. So, the point what is important in chronic hypertension is that when you see a patient for the first time and she is less than 5 months pregnant, you have seen her detected high blood pressure in her. One thing you have to understand is that she had this blood pressure even before pregnancy, and that is about chronic hypertension. The next type we see is chronic hypertension plus preeclampsia. So, what we mean by that term is that the patient was already having high blood pressure throughout, even before pregnancy, and during pregnancy she started manifesting the complications of that high blood pressure by developing protein in urine. So, she gets a chronic hypertension plus preeclampsia.
Now, what are the causes of this condition during pregnancy?
The cause is very difficult to identify and explain, but it's mainly immunogenic. The body's immune mechanism is itself causing this problem. So, what happens in so if you want to understand what is the problem, we have to understand what is happening in a normal pregnancy. In a pregnancy where there is no hypertension, okay, in such a woman, what is happening is that the placenta is the blood supplying organ. From the womb, it supplies the blood and nutrients to the baby. So, when this placenta is developing inside the womb, the placenta, the blood vessels from the womb, okay, it will dilate 10 times more than its normal size, so that it can supply all the blood and nutrients to the placenta, and the placenta in turn passes it over to the baby for the proper development of the baby. So, that is what happens when there is no hypertension. But in a patient who is having hypertension, these blood vessels, what happens to the blood vessels in the womb is it becomes very, very shrunk, okay, it just shrinks and it will collapse, there will be some fibrous changes, and what happens? So, the blood is not going from the womb to the placenta, and the placenta it's not growing properly. So, the placenta there becomes abnormal, and an abnormal placenta, it will bring up an immune reaction, a very drastic immune reaction in the body. The main immune reaction, when there is an immune reaction, what happens is mainly it affects the blood vessels in our body. The blood vessels get damaged, there is severe inflammation. Inflammation happens when there is too much of immune reaction happening inside the body. That is not a favorable thing for the baby. So, with this immune reaction happening, there will be a lot of water and protein leaking out of the blood vessels are getting damaged in our body. So, the blood vessels which is supplying to all the organs in our body, each blood vessel, even the tiniest ones, the biggest ones get damaged, and that results in the organ damage that happens in hypertension. And at the same time, the placenta being shrunken and abnormal is unable to transfer the nutrients to the baby. So that can result in the baby's growth also being affected. So this is the basic thing that is happening in hypertensive woman.
Okay. Who all are prone to gestational hypertension?
Yeah. So as you know, not all women are having hypertension in pregnancy. So it is mandatory that we look out for the risk factors or the women who are having the tendency to develop this in pregnancy, so that we can treat it accordingly. The commonest risk factors we have seen is extremes of maternal age. So if you see a woman less than 20 years who is getting pregnant for the first time, she is at high risk of developing hypertension. At the same time, a woman more than 40 years also has a high risk of developing hypertension. The other risk factors which we see very commonly is women who have a family history of hypertension or who have had a previous pregnancy with hypertension. All these people are at more higher risk. Then if there is multiple pregnancy, women with twin pregnancy, triplet pregnancy, because they have more placentae within them, so that reaction, the damage cost is more, so the chances of hypertension increases. There are some other medical conditions like metabolic disorders. Metabolic disorders, these are relatively rare, but any person who is having such conditions, I can give you some example, maybe hyperhomocystinemia, antiphospholipid antibody syndrome. These are some rare conditions, not seen in the general population that much, but if you have this, there is a higher chance of you having a hypertension. Then if there are associated medical conditions, like if there is a woman with obesity or diabetes, or if she is having some other kidney problem, all these ladies are at a more prone to develop hypertension.
Okay.
All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Now, doctor, what are the treatment options you go for if you find a pregnant lady with hypertension?
So once hypertension has been detected, diagnosed, the next level of thing what we can do is we need to do blood tests and urine tests for this lady. Okay, the blood test means we will be generally doing a kidney test, liver test. All these have to be monitored and see the parameters if all are in the normal range. So if everything is normal, the urine is also normal, that means only the blood pressure needs to be managed. So the first thing we will do is we have to definitely, the first line of management will be advising her about the diet and about whatever lifestyle modifications she needs. And beyond that, we will also need medications in most cases, okay, because the normal blood pressure should stand somewhere between 130/80 to 140/90. It should not cross 140/90, right? So there are medications. We have antihypertensive drugs specifically given in pregnancy, which is safe for the baby as well. So these drugs will be prescribed once the hypertension is detected. Other than just giving her medications, the regular monitoring becomes very important in a woman with hypertension, because anytime there can be derangements in her organs or in the growth of the baby. So both mother and the baby need to be monitored. So every 2 weeks we have to advise the patient to come for checkup. We will check her weight gain. Well, there should not be excessive weight gain as seen because of the fluid accumulation. So we have to check her weight gain, we have to monitor the blood pressure, do the blood tests every 2 weekly, and for the baby we have to monitor for the baby's growth, the fetal growth. We will, the ultrasounds are done more regularly to look for the baby growth and for the fluid volume.
Doctor, can you explain the complications of gestational hypertension for us?
So hypertension is quite a deadly disease and it affects both the mother and the baby. There are complications for both, and first it affects the mother, of course. So the maternal complications we come across is mainly organ damage. As I explained earlier, like all the organs are getting involved when you are developing a hypertension. So the main organs, it can affect the brain. Okay, if there's a brain damage, brain is getting affected, that can result in a brain hemorrhage also. In the worst cases, that can go in for stroke, paralysis, and as we explained, the patient can develop eclampsia. Okay, when the blood pressure is uncontrolled, she can go in for fits, convulsions. Then the hypertension badly affects the kidneys. So there will be pulmonary, there will be pedal edema, there will be too much swelling of the feet, the urine output decreases, patient is not passing sufficient urine and all the fluid is getting accumulated in the body. Then there is a liver damage happens, there will be bleeding inside the liver. These all are very, very dangerous complications of hypertension if uncontrolled. And there is another term we call abruption. In abruption, what is happening is that the placenta, it gets, there develops bleeding within the placenta and the placenta gets separated from the womb. So that can be very detrimental for the baby and the mother. The mother will develop severe bleeding and the baby, that can result in death of the baby. So in those cases, we will have to immediately deliver the baby. The other complications are mainly the complications to the baby. The fetal complications we come across mainly is prematurity. Because of all these problems, we need to save both the mother and the baby, especially the mother will be having severe complications and we need to deliver immediately. So the baby is born premature, the baby may have lung maturity issues, respiratory distress, difficulty in breathing. Then the baby can have other metabolic complications because of the low birth weight. The other complications that the baby can have is because of the prematurity mainly. That is the main thing we see, and even because of abruption, it can even result in a fetal death.
So another common query is, can we prevent this condition?
Prevention is possible to an extent, okay, especially when you cannot prevent hypertension much. You cannot do much to prevent it, especially if the patient is having these kind of genetic conditions, metabolic disorders. So hypertension is most prone to occur in these patients. But patients who are developing it, ladies who are developing it secondary to obesity or their lifestyle, that surely we should advise them to modify that, and to some extent we will be able to prevent it.
Okay, as you mentioned now, can you suggest some lifestyle modifications to normalize hypertension?
For hypertension, and the first and foremost thing is concentrating, paying attention to your diet. Okay, so in the diet, the most important suggestion, the most important advice you have to give is for the salt restriction. Okay, so for any patient who is having hypertension, for any lady with hypertension, we have to tell them that salt has to be restricted in her diet. So the added salt that she puts in all her curries and foods should be limited to maybe 1 or 2 teaspoons a day. And there are now some low sodium containing salts available in the market, like pink salt and all. So maybe she can try that also. Those are good options. Moreover, they are iodized also. So that is one thing. Other than this added salt in our diet, she should totally restrict herself from taking any salty foods, especially the processed foods, packed foods, and like chips and all, chips and sauce, ketchup, all these contain very, very high amounts of salt, which should be totally avoided. Then there are sports, some very sportive women may be taking sports drinks and all, thinking it's nutritious for them. That also should be totally avoided in hypertensive ladies. Apart from reducing salt in food, the other thing that should be added should be fiber. Fiber should be added into our diet. For example, that is the routine thing we are taking. We know it's nutritious, so green vegetables, fruits, all that. Other than that, high protein food. So for protein, we have to depend on lean meats like chicken, then egg, fish. Other than all these protein-rich foods, then we have to also concentrate on having high potassium in our diet. So it is low sodium and high potassium. So high potassium foods will be banana, sweet potato, beans, all those stuff. That is also very good. Then in protein, yes, I forgot to mention, dairy products are very useful. Dairy products, legume, then dal, all that stuff is very, very good. Now apart from diet, the regular substances that now many people are using, that also should be avoided. For example, like alcohol and smoking has to be completely cut off, because not only that will cause hypertension for the lady, but also cause birth defects in the baby. So these two should be totally cut off. Other than that, many of us are in the habit of taking a lot of caffeine. So tea and coffee, those tea and coffee drinkers can have maybe 1 or 2 cups of tea or coffee a day, not more than that. Apart from diet, we have to also advise for the exercise. So there are ladies who have never exercised before pregnancy. For them, at least 30 minutes of brisk walk will be very helpful. It should not be like that they are totally sedentary. They should have at least that much. And for women who have been more energetic, more sportive before pregnancy, they can continue the same exercise routine even during pregnancy. There is no harm in that. And beyond all this hypertension, there are some other natural methods and all, like de-stressing and all that deep breathing exercise. These all help in a way to control the hypertension to some extent. Yeah, stress is a very important cause of hypertension nowadays. So that is why it is very important to understand what are your triggering factors and try to get it under control.
So doctor, another common query is, can a woman with hypertension have a safe pregnancy and normal delivery?
Yeah, of course, that's our aim, that she should have a safe pregnancy and a normal delivery. Regarding the safety of the pregnancy, once a woman is detected to have high blood pressure, that is going to be a complicated pregnancy, in the sense that we have to be more alert. Both the gynecologist and the pregnant woman, both of them should be very alert and very keen on keeping the antenatal checkups very frequent, doing the blood pressure monitoring. We suggest all our patients, we recommend all our patients to keep a blood BP apparatus at home itself, so that they can monitor the BP themselves, because only we can maximum call them maybe once a week or twice a week, once a week or once in 2 weeks, right? So it's always good to have it at home, so that once the tablets, the medicines have started for them, they can record the blood pressure themselves, they can understand, they can compare and see if the blood pressure is dropping too much or still being uncontrolled. Based on that, we can step up the dose or decrease the dose of the medicines. So if we go by in sync, definitely the pregnancy can be going on a safe route. Regarding normal delivery,
all your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness. All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Third common query is, can a woman with hypertension have a safe pregnancy and normal delivery?
Yeah, of course, that's our aim, that she should have a safe pregnancy and a normal delivery. Regarding the safety of the pregnancy, once a woman is detected to have high blood pressure, that is going to be a complicated pregnancy in the sense that we have to be more alert. Both the gynecologist and the pregnant woman, both of them should be very alert and very keen on keeping the antenatal checkups very frequent, doing the blood pressure monitoring. We suggest all our patients, we recommend all our patients to keep a blood BP apparatus at home itself so that they can monitor the BP themselves, because only we can maximum call them maybe once a week or once in 2 weeks, right? So it's always good to have it at home so that once the tablets, the medicines have started for them, they can record the blood pressure themselves, they can understand, they can compare and see if the blood pressure is dropping too much or still being uncontrolled. Based on that, we can step up the dose or decrease the dose of the medicines. So if we go by in sync, definitely the pregnancy can be going on a safe route. Regarding normal delivery is definitely the way of delivery we prefer for all patients, and that is no different for patients with hypertension. Normal delivery is much more safer than cesarean section, but there are certain situations in which, certain conditions in which we may not be able to go in for a normal delivery and we will have to consider a cesarean section. So those are the conditions when her blood pressure is uncontrolled even with medications, and we are having to use IV medications, injectables. We are taking injectables to control the BP, still the blood pressure is not controlled, the blood parameters are severely deranged, or she's throwing a fit. Okay, these are conditions where you cannot wait for the progress of a normal delivery to happen and have to immediately deliver the baby out. And there is the other fetal reasons why, for the sake of the baby, if the baby's heart rate is dropping, or the growth retardation is so severe that the baby cannot withstand the course of a normal delivery, or in all these situations we will have to progress towards a cesarean section, but otherwise always a normal delivery is preferred.
So doctor, can you provide a takeaway message for our viewers?
The most important thing begins from before pregnancy, that is the preconceptional counseling. Always before planning to conceive, it's best to know what are the problems you can anticipate, and if you have any, only if you go and get your blood pressure checked will we know whether you have a blood pressure or not, right? So if there is a hypertension, that has to be treated even before conception, it has to be normalized. Any other associated conditions are there, that also has to be checked and treated, so that the baby doesn't suffer during the pregnancy. Moreover, when we are taking medications, there are medications which are safe in pregnancy and which are unsafe in pregnancy. So the unsafe pregnancies can result in birth defects. So when a patient comes before getting pregnant, we can give her the safer medications so that there's no harm to the baby.
Okay, thank you doctor. Thank you for giving us a lot of valuable information about hypertension in pregnancy. Thank you once again.
Welcome.
So viewers, I hope this was a very informative episode. If anyone has hypertension during pregnancy, don't panic, go for medical intervention and take care of your health. Till we meet again in yet another episode, this is Jessila Mujib signing off. Good night.
All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of